Hello, future PTA students. This is Emily Norris, and today we're going to start our physical agents class. So, we're going to start kind of on a background of the physiology behind physical agents. All right, here's an outline of kind of what we're going to go through. You can read that on its own, but on your own. But um, physical agents, what they are. So, energy and materials applied to a patient. Some of the agents we use include heat, cold, water, pressure, sound, electrical currents, and electromagnetic radiation. So, physical agents describes a type of energy. Other words that we use for physical agents include physical modality, biophysical agent, or modalities. I learned it as modalities, so you'll hear me use that term a lot, but all of them are interchangeable. Some of the categories that you can break down physical agents into are thermal agents, electromagnetic agents, and mechanical agents based on kind of what they use and what they're used for. Thermal agents, so they transfer energy to a patient to increase or decrease the temperature of tissue. So that's like heat, ice. Ultrasound can have a thermal component, diathermy, whirlpool, and all of those are used to change the temperature of the tissue. It can be a superficial or a deep change in the temperature. Electromagnetic agents, they apply energy in the form of electromagnetic radiation or electrical current. Some of the ones that you'll see used in a PT clinic include UV radiation, infrared, laser, diathermy, or electrical current. Mechanical agents, so they apply force to increase or to decrease pressure on the body. Water is a mechanical agent because of the hydrostatic pressure that water applies when you are submerged in water. Traction, compression, and ultrasound all also are under the mechanical agents category. Some of the effects that physical agents have: they reduce inflammation, increase tissue healing, they relieve pain, they modify the muscle tone. Whether you have too much tone, they could decrease it, or in some cases, like neuromuscular e-stim, they may be able to increase your muscle tone, and they can alter the collagen extensibility, like making tissues move further, stretch further, have better range of motion by altering the elasticity. Some of the contraindications, just in general, when using physical agents: if somebody is pregnant, has cancer, has a pacemaker or some other implanted device, or if they have impaired sensation and aren't able to tell you how it feels, those are all typically contraindications for modalities in general. So you wouldn't use any of the modalities in most of those cases. Sometimes it's a precaution, like let's say pregnancy. If you were doing an ultrasound on the foot, it'd probably be okay, but definitely not on the belly, over the uterus, things like that. The type of ultrasound we use in PT, at least. So these are contraindications. So um, things to consider when you're deciding whether or not to use physical agents. These are some of the things that would say no, it's not safe to use. When you're choosing what agents to use, you want to determine what the primary problem is and the problems that are most likely to respond to whatever interventions you have available. So, some of the things you consider is: what is the primary problem of highest priority? Um, is the problem most likely to respond to the treatment, or which problem is most likely to respond to the treatment? Sometimes using treatments that address more than one problem at the same time would be encouraged or preferred if possible. If you're only treating symptoms, so like ideally you're wanting to treat the cause of the symptoms and not just the symptoms. So in a one sense, like edema, if somebody has pain and swelling and you get some of the swelling out and address the pain at the same time, maybe by ice or something like that, then you would want to choose that versus a modality, maybe interferential current, that mainly just works on the pain and not the swelling, or any of the causes of the pain. So if you can only treat the symptoms, then that's kind of low on the priority list. That's not your ideal situation, but they could still be used in that way. Some of the attributes to consider when you're selecting what modalities to use: are the goal and the effective treatment, contraindications and precautions, which we'll go over for each modality, evidence for the use of the physical agents, and then cost, convenience, and availability of the agents that you're wanting to use. So there's kind of a wide variety of use in physical therapy. Some people use modalities often, some hardly ever at all. Typically, when you are using them in combination, sometimes they'll work better together. A lot of times you'll see heat or ice with e-stim, or you will see a modality used right before a stretch or something. So you want to kind of combine the effects. Um, you can typically combine them when they either have similar effects or they're addressing different aspects of the symptoms. So, one the example they gave is RICE, rest, ice, elevation, compression, which are typically used in conjunction, all to treat inflammation. So, they're kind of doing different things to treat the same problem, but they work better together. Um, Most of the time, we use more physical agents at the beginning of treatment, like when people first start coming to PT, and then we kind of fade them away as we do more strengthening and functional mobility and things like that. Documentation is everything when you're doing modalities because not only are you recording what you're doing and what body part and making it to where another therapist could read your note and reproduce exactly what you did, but also you're covering your own butt. In documentation, that is always one of the things. You're making sure that you record that you did all the proper steps so that if something adverse happens, then you're covered and nobody's wondering, did you check their sensation and should you have not done it in the first place? So some of the things that you document are the exam findings, evaluations, interventions, plans. Specifically, when you're documenting modalities, I would document all the parameters, where on the body you put the modality, what position the patient was in, how long you used it, and what the effects were. If there was any redness or if the patient complained of pain, anything like that that you observe or that they tell you while doing the modality, I would document. Um, your documentation, of course, is your long-term record of what happened, and it helps you get reimbursed. And of course, it would also help you if something went wrong and you needed to protect yourself or the patient as far as a court case or anything like that. All right, that is it for chapter 1. And um, we will go ahead and do chapter 2 as soon as I figure out how to stop recording.